Hello everyone and welcome back to our channel GDC Classes English. Today in this session we are going to discuss the Super Model Paper number 4 specially designed for Telangana Pharmacist students. As you know, we have started the new pattern, 3 days back to back, 3 mock tests. So this is the second mock test and already on Telangana Pharmacist batch you have attempted the test of these questions. So now let's discuss the explanations of these questions. Let's start with the first question, which is from Pharmacology. We will discuss the 16 MCQs. Your first question is, the following are anti-malarial drugs except. We have anti-malarial drugs. Anti-malarial drugs means which act against the malarial parasites. And you know, whenever we talk about the malaria, the drug of choice is quinolones. What is the drug of choice? That is quinine, chloroquine, amodia quinine. Next we have primaquine. But this atenolol, this is the drug of olol, means beta blocker drug. And the word where you will get quinine at the end, that means those drugs are of specially for anti-malarial drugs used to treat your malaria. So what will be the correct answer? Atenolol. This is not a drug of your anti-malarial classification. Clear? See, this is the classification for anti-malarial drugs. 4-aminoquinolones, quinolones, chloroquine, amodia quinine, piperaquine. These drugs are of your anti-malarial classifications. We have many more, that is quinolone, methanol, that is mefloquine, cinchona alkaloid like quinine, quinidine. Next we have bigarninide, that is proguanil. Next we have every term, at every second word you can see queen. Clear? So these are the drugs of your anti-malarial. Now let's move on to the next question. All are local routes of drug administration except. Now at once when you will see the question, you will get confused that topical is a local route, but you will say, ma'am, all these three are of parenteral route. But no, all of the three are this and this. These three are a type of local route of drug administration except your nasal, because whenever something you are inserting from your intranasal part, there are blood capillaries that directly absorbs the drug to the blood. And we have topical, means which we apply topically over your skin. Next we have intra-articular. Now what is this intra-articular? This intra-articular is given on your knee, on your joints, especially on cartilages. This comes under local route because it is given for a function at a specific local area, not for the systemic, not it includes the complete body. It doesn't complete the blood circulation, but it is given at a specific local area. That's why it is included in the local route of administration. Same we have the intra-arterial. In the condition of inflammation, in the condition of pus, we give intra-arterial drug. That is also given for a local area. So that's why this also comes under the local route of administration, but the intranasal is your systemic route of administration. Clear? You can remember these chart. Okay. Next question. Teratogenicity refers to teratogenicity, genes. You can remember from these genes that something related to your baby or generation transfer. So generation transfer occurs whenever we give birth to our next progeny. So teratogenicity is the term which is related to the abnormalities or defects caused due to some drugs in your fetus while your mother is pregnant, and if she consumes tetracycline, that is a teratogenic drugs which causes defect in your fetus, that is known as teratogenicity. So the correct answer will be ability to cause defect in the fetus is your teratogenicity. Clear? There are many drugs like tetracycline, thalidomide, phenytoin, sodium valproate, alcohol and lithium. These are contraindicated in the case of the pregnant women as it causes teratogenic effect. Next question. Anticholinergic used as bronchodilators. Anticholinergic drugs are the drugs which reverses the action of your cholinergic receptors. That means your acetylcholine is a neurotransmitter and it is blocked by your anticholinergic drugs. And how it is used as bronchodilator? Because your atropine, your ipratonium, these are the drugs which acts on the lungs and causing your bronchodilation. It is used at the condition of your asthma patient. Clear? And the ipratonium is the anticholinergic drugs used for or used as your bronchodilator. Clear? Okay. Next question. Drug of choice for the treatment of sleep worker disease. Now everyone will see the question and they will just assume sleep means caffeine. We can remove the sleepiness by using caffeine. But no, we are asking about the drug of choice. And the drug of choice is your modafinil because it acts on your dopamine receptor and your dopamine is responsible for the sleepiness and wakefulness both. Okay, your dopamine is responsible for your sleepiness and your wakefulness. So it blocks the dopamine. Clear? Okay. Now, the next question. Which of the following anti-Parkinsonian drugs directly activates dopaminergic D2 receptors in the striatum? Okay. First of all, the correct answer will be your pramipexole. Clear? Now, let's just understand the concept because this is the drug and you need to remember. Okay? Now, the anti-Parkinson drugs. This is a disease of your central nervous system. Alzheimer is a disease of your central nervous system. And the dopaminergic D2 receptor is present on your central nervous system. So, this and when at the case of a Parkinson, that is a deneurogenerative disorder. Means once your brain cells are dead, it is impossible to regenerate them at the condition of Parkinson. So, to treat it, we need to discover some new cells. So, anti-Parkinsons activate dopaminergic D2 receptors to form or to carry on the functions of your central nervous system, and the drug will be pramipexole. Clear? Okay. You can also remember that ergot derivatives are and what are non-ergot compounds. Clear? Now the next question. One of the following drugs is not a aminoglycoside. One of the following is not a aminoglycoside. I think the answer is very clear because this myosin and myosin all are the antimicrobial drugs and it comes under, or we can say aminoglycoside is an antimicrobial drug, acts with the mechanism of action of it inhibits the protein synthesis inhibitors. So, adrenaline is a type of hormones also responsible for the adrenaline rush in your body, but natriamycin and tobramycin and amikacin, these three are your aminoglycosides. Clear? And adrenaline is not a type of aminoglycoside. Also, you can consider it as a hormone. Clear? Okay. Next question. See, this is the classification of aminoglycosides. If you remember little amount of Hindi language, then you can remember GST ka snap bheja, and the drugs are from G gentamicin, from S scizomycin, from T tobramycin, from K kanamycin, from S streptomycin, from N natilmycin, from A amikacin, from P paromomycin, but not fixed. So, from N neomycin and F framatocin. Clear? Okay. Now, the next question. Cinnarizine has following actions except. Your cinnarizine has following actions except. First of all, you need to understand that this cinnarizine is responsible for your action in GIT. It plays the anti-emetic actions like in antimuscarinic. How it plays a role in antimuscarinic? Antimuscarinic has the D2 receptors, which we have already studied in the previous model paper, that there is a CTZ zone, that is which blocks your GIT peristaltic movement. It also helps to inhibit the anti-vomitic action. Both 5-ST and antimuscarinic plays the same role. Also, your calcium channel blocker, like there are two types of blocker, L and T. What does it happen in L and T? Present on your smooth muscles. It also blocks the calcium channels to inhibit the vomiting. But the sodium channel blocker is present especially for your heart. It is present on other parts also, but mentioned especially for your heart. These three have the same mechanism to inhibit your vomiting process. Clear? Okay. Now, the next question. Antimicrobial effect in inhibiting RNA polymerase enzyme. Now, your rifampicin is a antimicrobial agent which works with the mechanism of action by inhibiting RNA polymerase enzyme. Clear? This is the mechanism of action, that your rifampicin inhibit RNA polymerase enzyme. Next is your nitrofurantoin. Nitrofurantoin blocks your TCA or the DNA synthesis. TCA means your citric acid cycle synthesis. Also your nalidixic acid inhibits the DNA gyrase, and your fluconazole is a antifungal drugs. Clear? So what will be the correct answer? Your rifampicin. Clear everyone? Okay. Next question. Which of the following anti-malarial drug causing black water fever? What is this black water fever? Black water is a condition when there is a massive destruction in the red blood cells, causing the hemoglobin to circulate in blood in the maximum amount as well as in your urine. Now, whenever you see the maximum amount of hemoglobin on a dish, on a plate, it something feels like a black in color due to the dark red color accumulate in a large amount. So that's why it is known as your black water fever. And the anti-malarial drug causing black water. So anti-malarial means quinine. See, this is quine, this is anide, this is quine, but this is quinine. This is the antimicrobial drug, anti-malarial drug. Clear? It causes black water fever. Also, you know, at the time of malaria condition, it infects our blood. Clear? There is the destruction in our RBCs. Okay. Next question. Phytostigmine is indicated for, very easy question and the simple question. Phytostigmine is given for the belladonna poisoning. Clear? Very simple and direct question. Okay. Next question. Which one is correct about ticlopidine acted? Which of the following is a ticlopidine acted? It acts by decreasing the ADP mediated and CAM. It activates the CAMP. The drug of mechanism of action of your ticlopidine is that it decreases the ADP, that is your energy process synthesis. Clear? Okay. Next question. Which of the following drug does not inhibit 14-alpha demethylase? Now, what is 14-alpha demethylase? Your 14-alpha demethylase is an enzyme. From age you can understand it is a type of enzyme. This inhibits the enzyme that play a key role in your sterol biosynthesis. Clear? And it affects mainly your microbial infections causing like by bacteria. So here fluconazole, metronidazole, ketoconazole and itraconazole, fluconazole and ketoconazole, these are the drugs responsible for the treatment of your fungal diseases, but metronidazole is used for your microbial treatment. Clear? Okay. Next question. Oral anti-diabetic drug sitagliptin act by. Now, anti-diabetic drug, what will it do? Anti-diabetic means, I think it will inhibit the something like insulin production. It will have a relation with a sugar or a protein. So, insulin is what? It is made up of 51 amino acids. That is a type of peptide bonded by a peptide bond. So, you can from that you can correlate that it inhibits the dipeptidyl peptidase 4, DPP4. It inhibits your DPP4. It is a type of DPP4 inhibitor. Clear everyone? Okay. It will just lower your meal time as well as the fasting time. That is, the blood sugar level will be decreased. Clear? Next question. Which of the following are bile acid sequestrant? Now, bile acid is responsible for the destruction of your fatty acids, or we can say fats. That is your cholesterol. Cholestyramine will be the bile acid sequestrant. It is responsible for the production of your bile acid. Clear? Okay. Next question. Which of the following agent is used for the treatment of petit mal epilepsy? It is a type of central nervous system disease, and the agent used to treat petit mal epilepsy is ethosuximide. What is it? That is ethosuximide. Clear? See, you can understand from this chart, and is important as well. You can take the screenshot. Partial seizure, it can be treated by carbamazepine. Next is sodium valproate. Likewise, your generalized or tonic clonic seizure can be treated by sodium valproate. Next is petit mal seizure, also known as absence seizure, can be treated by sodium valproate and ethosuximide. Next we have the myoclonic seizure treated by sodium valproate. Next, atonic seizure treated by sodium valproate. Febrile seizure treated by diazepam. Status epilepticus treated by lorazepam. These are the first line drugs and these are the alternative drugs. Clear? Understood? So, for petit mal we use ethosuximide and sodium valproate is common for maximum of the drugs. Okay? Now, okay, next we have the 8 questions from human anatomy and physiology subject. The first menstrual flow is known as menopause. That is at the age of 50 when you will have the stoppage of your menstrual cycle. Menstruation, this is the time when you are going through your periods. Menarche, this is the time, the first day when you get your periods in your life is your menarche. This is the first menstrual flow. Ovulation is the ovulatory phase where the ovum is developed. Clear? So, what will be the correct answer? That is menarche. Okay. Next question. Which sequence best describes the flow of lymph through the lymphatic system? See, this is your blood vessels. Some amount of your WBC and plasma along with water and electrolytes comes out of the vessels due to a certain pressure. Now, these WBC plasma, as it reaches the tissues, they are known as now lymph, and this lymph is then from the capillaries, this is the capillaries, circulated to your lymphatic vessels. From vessels it get transfers to the trunks, and from the ducts these lymph, after the filtration by the lymph nodes, gets transferred to your blood vessels again. So, what is the process? First is capillaries, next we have the vessels, next we have the trunks, and the last we have the ducts which transfers your lymph to your blood. Clear? Okay. Next question. Which of these is known as the pacemaker of heart? Pacemaker of heart is your SA node, that is sinoatrial node present on the right upper corner of your atrium. Clear? Purkinje fibers provides the electrical impulses especially to your ventricles. Atrioventricular node, atrium and ventricle means the transfer of electrical signals is between atrium and ventricle. Bundle of His means it will transfer the electrical signals to the complete heart. That is known as bundle of His. The correct answer will be sinoatrial node. Clear? The hollow space in the middle of the bones is filled with. The hollow space in the middle of the bone is filled with your bone marrow and is responsible for production of your cells, that is blood cells, either white blood cells or red blood cells. Clear? Okay. Next question. Cochlea is a part of your internal ear and is responsible to convert the vibrations into the nerve impulses that your brain will understand. So, cochlea is a part of internal ear. Clear? Okay. You can take a screenshot of this chart and can study that your pinna, this is your pinna, it collects the sound waves, helps in collecting the sound waves. Next we have the ear canal. This is the canal from in which you use the earbuds to clean your wax. So that is the canal. It allows a passage to transfer the vibration. Next we have the eardrum. That is your soft skin covering the hole, that is eardrum, and it reflects the vibrations to your bones. That is, we have the three types of bones, that is stapes, malleus and incus, and the stapes is the smallest bone of your body. Next we have ossicles, which amplify the vibration of sound and pass to oval window. Oval window transfer the vibration of sound to cochlea. Now this cochlea will change the vibration into nerves impulses, and the auditory nerve now will transfer those nerves impulses to your brain. Clear? So these are the parts of your ear. Now next question, what is glycosouria? Glyco means glucose and urea means the high amount of sugar in a urine is your glycosouria. Clear? Okay. Next question. What is the function of somatostatin? Now what is this somatostatin? It is secreted by the delta cells of your pancreas and it inhibits the release of your insulin and glucagon. So what is this? This is also a type of growth. It inhibits the growth hormone release. Clear? Okay. Next question. Which of the following provides passage for menstrual flow? From where your menstrual flow blood, that is the blood passes, is your vagina, not the clitoris. From the just below the clitoris, the urine is excreted. Not the mons pubis, not the vulva, but the vagina just transfers the blood out of the body. Clear? Okay. Next question. This is from biochemistry, that is the 8 questions. So let's start from the very first question. Lysosomes are known as suicidal bags because, yes, lysosomes that are known as the suicidal bags. Why? Because it contains some hydrolytic enzyme. Hydrolytic enzyme means the enzyme which causes lysis in presence of water. And what are those enzymes? Nuclease, lipase, that is protease, means the one who will break the protein, protease. The one who will break the nucleic acid, that is nuclease. The one who will break the lipids is lipase. So it is responsible to kill its own cell constituents. That's why it is known as the suicidal bags. Clear? Okay. Next question. Which test used for the distinguish between monosaccharides and disaccharides? Okay. Mono means single. From mono, that is single, and from bar we just go to bar and have a single peg. So from this trick you can remember that Barfoot's test is responsible to give positive test for your monosaccharides. Mono means single, and at bar you are taking a single peg, that is your Barfoot's test. So it will also acts as the distinguished test between your monosaccharides and your disaccharides. it will give positive for monosaccharides, then it will confirm the presence of monosaccharides, and the other part is known as your disaccharides. Clear? Okay. Next question. KOH plus hydrated copper sulfate plus sodium tartrate reagent used for, see, all these three tests all these four tests is for your protein confirmatory test, and this reagent is the combination of your burette test. You need to remember this, there is no trick to remember this, okay. So the burette test has the reagent KOH plus hydrated copper sulfate plus sodium potassium tartrate. It will give the purple color and it confirms the presence of peptide bond. Clear? Okay. Next question. Phosphate group are contain which type of components? See, just to make a help to remember this, I will just inform a small trick. See, nucleo is the same word, T and S. T means 3. Means all the 3 bases will present, that is nitrogenous base, sugar base, all the 3 base will be present, phosphate base. But from this S, one of these, the side group is expelled, that is the phosphate group, CSS. Clear? Clear everyone? So this is the phosphate groups, means nucleoside doesn't contain the phosphate group, it contains the amine group plus sugar group, but the nucleotide contains all the 3 groups. Clear? Next question. Activation energy required in presence of enzyme. Now, activation energy, if your process is containing an enzyme or the enzyme is used as the catalyst, means there is no need to provide the extra energy to convert the process. Clear? Because this enzyme will activate the activation energy and automatically the process will be fast. So that's why the activation energy will be low when the enzyme is present in your process. Clear? Without the enzyme, if the reaction is not having an enzyme as a catalyst, means your activation energy will be high, because to complete the process we will need and we will provide more energy. Clear? Okay. Now the next question. Which type of catalyst breakage of CC plus CS plus CN bonds? Which type of catalyst? Say, isomerase is the enzyme which produces n number of polymers. Transferase is the enzyme responsible for the transfer of some groups. Oxidoreductase enzyme is responsible for the oxidation and reduction process, that is the removal of H and the addition of H. Next is lyase. Lyase means lytic, means lysis. It will break the bonds. So either it can be CC, CS or CN. So the correct answer will be your lyase. Clear? Next question. Mineral involved in the synthesis of thyroid hormone. Thyroid hormone is caused, or you can say thyroid hormone deficiency causes the goiter, and goiter is responsible when you have the deficiency of iodine. So what will be the correct answer? That is iodine. Clear? You can take this screenshot of this chart. Next question. Disease characterized by increase in the number of red blood cells. Increase in the number. Poly means increase in the number, means n number of polymers are formed, that is polycythemia is increased in the number of red blood cells. Sickle cell anemia means your RBCs are destructed, means destruction in RBCs leads to the less number of RBCs. Megaloblastic anemia and iron deficiency anemia also are the types of your RBC problems. Clear? So what will be the correct answer? That is polycythemia. Clear? So these were the questions from pharmacology, HAP and biochemistry. Now let's continue with the jurisprudence section with Ketki ma'am.
So hello dear students. So now let's see what are the important questions from pharmaceutical jurisprudence in our super model paper number 4. And if you know any of the answer, please let us know in the comment section. The very first question is, which chapter of the Pharmacy Act 1948 deals with the registration of pharmacists? Okay, so there are various chapters in the Pharmacy Act. So in the Pharmacy Act 1948, which chapters deals with the registration of pharmacists? Okay, so option A is chapter 2, option B is chapter 3, option C is chapter 4, and option D is chapter 5. Okay, so basically the registration of pharmacist, it deals with chapter 4. Okay, so it deals with chapter 4 of the Pharmacy Act 1948. Okay, so option C is the right answer, that is chapter 4. Let's see what are the other chapters. The first chapter is about the introduction. Okay, it is about the introduction, that will indicate your short title, some extent, and the commencement. Chapter 2 is the Pharmacy Council of India. Chapter 2 is the Pharmacy Council of India, which is also known as Central Council, Chapter 3 is related to the State Pharmacy Council. Chapter 3 is related to the State Pharmacy Council. And chapter 4 is related to the registration of pharmacists. Chapter 4 is related to the registration of pharmacists. So remember, these are the various chapters under the Pharmacy Act. The next question is, the function of Central Drug Laboratory, that is CDL, is option A is to issue repacking license, option B is to analyze the sample of drugs or cosmetics, option C is to issue loan license, and option D is to issue manufacturing license. Okay, so what is the role of CDL, that is Central Drug Laboratory? So they are there to analyze the sample of drug or cosmetics. Okay, so to analyze the samples of drug and cosmetic, it is the function of CDL, that is the Central Drug Laboratory. Okay, remember, Central Drug Laboratory. Okay, so their functions are to test or analyze the sample of drugs or cosmetics which is sent to them by custom collectors or courts, to carry out such other duties like central governments or with its permission by the state government, consultation with DTAB. Okay, so these are the various functions of Central Drug Laboratory. The next question is, medicinal and toilet preparations are stored in bulk jars or bottles, each containing. Okay, so there is a limit. Option A is not less than 2200 ml. Option A is not less than 2200 ml. Option B is not less than 2273 ml. Option C is not less than 2500 ml, and option D is not less than 2573. Okay, so when it comes to the bulk jars or the bottles in the Medicinal and Toilet Preparation Act, it should not be less than 2273 ml. Okay, so remember, option B is the right answer for this one. So it should not be less than 2273 ml. So the storage of the finished product. Okay, if we talk about the storage in bulk or the jars, it should not be less than 2273 ml. And if it is for the ready to use, then it should not be less than 57 ml. Okay, so you have to be careful what question and what ml they are asking. Okay, if it is a bulk, it is different, 2273 ml, and if it is ready to use, it should not be less than 57 ml. Next question is, penalty of imprisonment for not less than 2 up to 7 years occurs when? Okay, not less than 2 years, and it can go up to 7 years. This kind of penalty occurs when? Okay, option A is termination of pregnancy by a person other than RMP. Okay, so if any person other than RMP, that is nothing but your registered medical practitioner, so other than RMP is doing the termination of the pregnancy, so they will have this fine not less than 2, and which can go up to 7 years. Okay, so remember, this is RMP, registered medical practitioner. So option A is the right answer. Let's see what are the other option. Option B is willful contravention or willful failure to comply with the requirement of any regulation. Option C is eugenic abortion of the woman against her will, and option D is abortion of the lunatic. Okay, So option A is the right answer. If any person other than registered medical practitioner, if they are trying to do this termination of pregnancy, then they will get this penalty, which is not less than 2 and it can extend up to 7 years. Okay. So see here it is given termination of pregnancy by person other than RMP, that is registered medical practitioner, or termination of pregnancy other than the prescribed place. Okay. So there has to be a prescribed place by registered medical practitioner. If any other is there, then imprisonment for not less than 2 and it can extend up to 7 years. And if it is a willful contravention or willful failure to comply with the requirements of any regulation, willingly if any person is trying to not follow the rules, then also imprisonment or fine up to 1000 is there as a penalty to these offences. Okay. The next question is the Poison Act extends to whole of India, but it is not applicable to. Okay. So Poison Act, it will be applicable to whole of India, but not to state of Jammu and Kashmir. Okay. It is not applicable to state of Jammu and Kashmir. Union territories, yes, it is applicable to union territories. State of Maharashtra and Punjab and state of Goa. Okay. It is only not applicable to state of Jammu and Kashmir. Okay. So the Poison Act extends to whole of India, but it is not applicable to states of like Jammu and Kashmir, except to the extent to which the Poison Act relate to the import of any specified poisons. Okay. The next question is formula used for calculating retail price. Okay. Formula used for calculating the retail price. Okay. So you might have heard about MRP, that is maximum retail price. Okay. In that only we have this retail price. What is the formula? Okay. Here whatever you are seeing the abbreviations, in that one first is RP. So RP is the retail price. MC is the material cost, CC is the conversion cost, PM is the packing material, E is the excise duty, and MAP is nothing but maximum allowable post manufacturing expenses. Okay. And this is the packing charges, PC. Okay. So these are the different abbreviations. So in that one, the first we will do the addition of all of this. So option B is the right answer. Retail price is equal to material cost plus conversion cost plus packing material cost plus packing charges. All of the addition of these charges into 1 plus MAPE, that is maximum allowable post manufacturing expenses, divided by 100 plus ED. ED is nothing but excise duty. Okay. So option B is the right answer to calculate the retail price. Okay. So this is the formula where RP indicates your retail price, MC indicates your material cost, CC is nothing but conversion cost or conversion price, PM is packing material cost, PC is packing charges, MAP is nothing but maximum allowable post manufacturing expenses, and it should not be more than 100%. Remember this one. And ED is nothing but the excise duty. Okay. The next question is NDPS consultative committee consists of maximum of dash members. What is NDPS? NDPS is nothing but narcotic drugs and psychotropic substances. Okay, so the consultative committee of NDPS contains maximum of how many numbers? How many members? Okay, so option A is 15, option B is 10, option C is 20, option D is 25. Okay, so basically the maximum numbers members should be 20 in the narcotic drugs and psychotropic substance. Okay, so the central government appoints this advisory committee. Who has the authority? Central government appoints this advisory committee to advise central and both state government. Okay, and it is pertaining to NDPS Act, which is 1985, and the committee consists of the chairman and not more than 20% appointed by the central government. Okay, so this consultative committee consists of 20 members. It should not be more than 20, and it is appointed by central government. Okay. The next question is drugs are imported for examination, test or analysis. The form, okay, which is the form? Option A is form 24, option B is form 12, option C is form 10, and option D is form 29. Okay. So basically in the form 12 there is an import of drugs for testing and analysis. Okay. Import of the drugs for testing and analysis, that is given in form 12. Okay. Now there is different. If it is a small quantity of drugs for personal use, then for the application which is made in the form, that is given in 12A, okay, and the license which is granted, that is given in form 12B, okay. Whereas drugs specified in schedule C and C1, that is related to the parenteral one which requires certain care, so that is given application in form 8, whereas license granted in form 10, okay. And drugs specified in schedule X, which is nothing but psychotropic substances. It is a list of psychotropic, that is habit forming drugs. The application which is made is in 8A and the license granted in the form 10A. Okay, so these are the different imports of the drugs, the loan and the application form. So these were the important questions from pharmaceutical jurisprudence. You can see the remaining questions in the upcoming slides. Now let's see what are the important questions from hospital pharmacy in our super model paper number 4. So if you know the answer for any of the question, please let us know in the comment section. The very first question in hospital pharmacy is, on the basis of anatomical and physiological specialization, hospitals, what are the types except, okay, so basically there are various types of hospitals, so based upon the anatomical and physiological, that is the functional specialization hospitals. First is ear, nose and throat, that is ENT hospital. Option B is orthopedic hospital, that is related to joints. Option C is kidney hospital, again that comes in the organ. Whereas cancer hospital, okay, so in that one the anatomical and physiological. So cancer is related to the disease and it is not related to any structural or functional, okay. Anatomy is nothing but structural part and physiological is nothing but the functional part, okay. So cancer hospital, it comes under the disease part, okay. So option D is the right answer. So here you can see clinical basis of classification, and here it is a non-clinical one. Based upon the disease, we have cancer, leprosy, TB, psychiatric or mental hospitals. On the basis of patients, we have maternity, then it can be a gynecologist or pediatrician. And on the basis of anatomy and physiological, we have ENT hospital, we have kidney hospitals, or it can be orthopedic, okay. So these are the clinical. In case of non-clinical, it can be public ownership or it can be a private ownership, which includes trustees of hospitals. And on the basis of size, we have large, medium, very small and small type of hospital. Okay, it is depending upon what is the bed size of the hospital. The next MCQ is, hospital provides special facilities. Okay, nursing. Option B is dietary. Option C is blood banking. Option D is all of this. So let's see what is the answer. Yes, so it includes all of them: nursing, dietary, blood banking. So these are the facilities which are provided by the hospital. Okay. So in case of organization of hospital, it has executive, finance, hospital administrator, development and public relations. Okay. So basically it has all the services like clinical services, administrative, ambulatory, nursing and pharmacy services. The next MCQ is, the minimum training hours required for pharmacy registration is. So how much should be the minimum training hours? Option A is 800, option B is 100, option C is 500 and option D is 300. Okay. So to become a registration or the registered pharmacist, minimum training of 500 hours is required. Okay, minimum training of 500 hours is required. So yes, option C is the right answer. Okay. To become a registered pharmacist, individual must have passed a diploma in pharmacy from a recognized institution along with 500 hours training in a government hospital or a B.Pharm from a recognized institution. The next question is, the disadvantages of satellite pharmacy is. Option A is efficiency, drugs can be distributed. Option B is time of drug distributed could be reduced. Option C is effect on the budget of hospital. Option D is none of this. Okay. So the disadvantages is effect on the budget of hospital. Okay. So there are various other disadvantages of satellite pharmacy. Inventory increases, therefore the budget also increases of the hospital. Paperwork maintenance costs are increasing. Separate space is required for keeping the stock. So these are the different disadvantages. The agenda of PTC should be prepared by. PTC is nothing but Pharmacy Therapeutic Committee. Okay, so that is PTC. What is the agenda? Option A is physician, option B is pharmacist, option C is nursing representative, option D is hospital administrator. Okay, option D is hospital administrator. So what should be the answer? If you know, please let us know. So it includes the pharmacist. Okay, it should be prepared by pharmacist. The agenda of this committee. Operation of Pharmacy and Therapeutics Committee. It should meet regularly, at least 6 times in a year, and also when necessary. Okay, 6 times means twice 2 months, at least once in 2 months they have to meet, or as and when required. Agenda and the supplementary materials should be prepared by the pharmacist. The next question is, who plays a vital role in drug safety in hospital? Okay, option A is PTC, that is Pharmacy and Therapeutic Committee. Option B is GMP. Option C is ADR, or option D is GPP. Okay, so who plays a vital role? That is a committee, that is a Pharmacy and Therapeutics Committee. So drug safety is one of the major responsibilities of the hospital pharmacist, okay, which comes under the PTC, because that ensures the safety of that particular drug. It plays an effective role in ensuring the drug safety on a continuous basis, and by creating the awareness in all the department of the hospital, and this work is done by PTC. Okay, so remember, drug safety is one of the major responsibility of Pharmacy and Therapeutics Committee. The next question is, entries in formulary are, except formularies. We have already seen earlier in the earlier model paper, formulary is nothing but the drug information, right? So what it includes the entries? Generic name of the drug, yes, it should have the generic name of the drug. Brand name of the drug, yes, it should have a brand name of the drug. Dosage form, strength, and the packaging, yes. Floor ward stock system, the entries will not include the floor ward stock system, but it will include all of the above information, right? So option D is the right answer for the formulary. So here you can see entries in formulary. It includes generic name, common name, dosage form, formulation, controlled substance symbol, index to the drug product list. So according to generic name, brand name, or the pharmacological index, information on hospital policies can be given, and the special information, if it is there, for example, poison control information is there, or any observation or sugar-free products. So special type of information is given in the index to the product drug list. The next question is, given the following are secondary source information. We have already seen that we have primary source of information, we have secondary source, and we have tertiary source, right? So primary information comes from your R&D, right? Secondary information comes from your, like for example, review article is there, and tertiary information comes which is not directly point out towards the problem, but it will come from the, for example, encyclopedia. So likewise we have different source of information, right? We have different source. In that, the secondary information will give you idea about the research paper. Okay, it will give idea about the research paper. Okay, so primary source is originating from the research and development. Then secondary source is pharmacopoeia, textbook, review articles, or formularies. Tertiary source is the encyclopedias, or it can also be obtained from the dictionary. They are already published. The next question, or the next further questions we are going to see from the topic of pharmaceutics. Okay, so let's see the first question. In which process the crude material is subjected to size reduction to get the powder to be in contact with each other for a longer period of time? Okay, so in which process we do this? Crude material is subjected to size reduction, okay, and it is in contact with each other for a longer period of time. Okay, option A is maceration, option B is expression, option C is percolation, option D is extraction. Okay, so maceration is the phenomena where whatever the solid residue will be separated, right? Whatever the solid residue or the material will be separated, that we will call it as a mark. That will call it as a mark. Okay, so that is nothing but maceration. Okay, That is nothing but maceration. So see, leaching, it is the process in which active constituents, they are selectively removed from the crude by the action of solvent. Okay, we will use certain solvent. Percolation, it is a leaching process. That means we will be using certain solvents in the column. Okay, it is packed into the column and it is allowed to pass through the material. Maceration, it is the product in which solvent and the crude material, they are allowed to be with each other. The solvent, it is also known as menstruum. Okay, the solvent, it is also known as menstruum. So that is nothing but solvent which you are using for the extraction, for the maceration process. And expression is nothing but removal of small quantity of liquid. Okay, so they are relatively larger amount of solid material by applying force. Okay, so that is the reason when coffee is also there, that is espresso, because of the process which they have utilized. Okay, the next question is, which is the filter used for clarification of syrup? Okay, option A is drum filter, option B is filter lip, option C is meta filter, option D is plate and frame filter. Okay, so basically for the clarification of the syrup, okay, syrup is nothing but sugar and water solution, we are using meta filters. Okay, we are using meta filters for the clarification of syrup. So it is used for filtration of injection solution. We will use filtration for injection solution. Clarification of insulin liquors or the solvents. Filtration of viscous liquid can be achieved by applying pressure. So syrup, we know it is a viscous liquid, so we are using meta filters. The next question is, particle size is cheaply reduced in fluid energy mill by. There are certain mills which are available, right? And this mill, they works on the principle of different mechanism. Okay. For example, if it is a cutting, so cutting, shearing will be a cutting mechanism. Impact means if it is striking to any harder surface, we call it as impact. Attrition means when the particles are rolling over each other. Okay, and the pressure. So basically this fluid energy mill, it works on the principle of impact and attrition. Okay, it works on the principle of impact and attrition. So this is the mechanism, impact and attrition. The feedstock is suspended within high velocity airstream. Okay, feedstock means the material which you are subjecting to size reduction. Okay, it will be passed and the collisions between suspended particles. These collisions, whatever collision is happening, that will give you the attrition. Okay, so that is the principle of fluid energy mill. Cellulose is a brand name of. Okay, so this is the ingredient which we are using in the tablet formulation. Option A is lactose, option B is maltose, sucrose and dextrose. Okay, so every ingredient will have their own brand name that you have to remember. So cellulose is a brand name for dextrose. Okay, right. Cellulose is a brand name for dextrose. Let's see what are the other diluents. So dextrate, it is MDEX. Okay, dextrate is MDEX. Dextrose means terpene and cellulose is there. Maltose means adventose is there. Mannitol means perlitol. Okay. Lactose monohydrate, that is Zeparox. Starch, that is pre-gelatinized starch. We have Pharmagel, Pregel, MDEX, Cellutab and Starex 1500. And then we have sugar which is compressible. So that is Diapag, Newtab, SugarTab. And microcrystalline cellulose we have Avicel, Ampocel and Vivacel. Okay. Remember one more thing, Avicel, it is present as 101 and 102 grade. 101 is the powder form and 102 is the granular form. Okay. So these are the grades of Avicel, that is MCC, microcrystalline cellulose. Okay. So these are the different grades available for MCC. Let's see the next question. Which among the following is a better thickening agents for suspension? Okay. Option A is acacia. Option B is tragacanth. Option C is starch. Option D is lactose. Now thickening agent. Why we will add the thickening agent? Because they will help to increase the viscosity of the formulation, and because the viscosity is increased, the rate of sedimentation will be reduced. It will reduce the rate of sedimentation. Okay, so this is one of the important thing, and because the rate of sedimentation is reduced, we are using. So in this case, for suspension, tragacanth will act as your better thickening agent as compared to other three options. Okay, so tragacanth act as the better thickening agent and it is used as a suspending agent in the suspension. Prescribing tetracycline with milk is which type of incompatibility? Okay, so we have physical incompatibility, we have chemical incompatibility and therapeutic. Okay, so if you are mixing any ingredients and if there is change in the pharmacological activity or therapeutic activity, we call it as therapeutic incompatibility. Okay, we call it as therapeutic incompatibility, right? So basically when tetracycline, this is an antimicrobial, when it is given with milk, what does milk contains? Milk contains calcium ions, right? It contains calcium ions. So basically what happened, before absorption, tetracycline binds to this calcium ions and it forms a complex. And now this complex will not get absorbed. There will be a hindered or it will affect the absorption of tetracycline. And if there is no absorption, the therapeutic activity will decrease, right? So this comes under your therapeutic incompatibility. This comes under your therapeutic incompatibility. So example is antibiotics when they are taken with the calcium ions. Okay. National Pharmacy Education Day is celebrated on. Okay, National Pharmacy Education Day is celebrated on 8th April, 6th March, 6th May, and 30th March. Okay, so basically it is celebrated on 6th March because in the honor of birth anniversary of Professor Mahadev Lal Shroff, who is considered as father of Indian pharmacy, right? Professor Mahadev Lal Shroff. In honor of his birth anniversary, we are celebrating National Pharmacy Education Day on 6th March. Okay. The next question is pyrogens present in containers can be destroyed by heating the containers at. First of all, remember autoclave, which is nothing but moist heat sterilization, will not kill the pyrogens. Okay. So in this one, for pyrogens, 121 degrees Celsius for 15 minutes, no. At 121, we will not able to kill the pyrogens. 121 degrees Celsius for 30 minutes, no. Again at 121, it will not able to kill. 210 degrees Celsius for 4 hours. 1 hour is not sufficient. 4 hours, 210 degrees Celsius, 4 hours, it is required to kill the pyrogens. Pyrogens are nothing but the metabolic products of the microorganism which is created, right? So option C is the right answer. Okay, option C is the right answer. So they may be rendered free from pyrogen by adequate cleaning and usually heating at 210 degrees Celsius for 3 to 4 hours. Okay. So that's all about the questions from hospital pharmacy and pharmaceutics. Stay tuned to see what are the upcoming questions from the different topics. So thank you so much.
So basically, in this part, we are going to plan with the complete syllabus of pharmacy questions. Then after continuing with the pharmaceutical chemistry questions. So I know very well you are the obedient student, but obedient students like sir, what is the meaning of obedient student? Means they are having the acceptability related to the order. Like a obedient student are having the thought like sir, your order are always acceptable. As we had ordered that you have to watch all the we can say model paper, all the test series you have to attempt, all the we can say content that is available on your purchase course as well as the YouTube, you must have to be watched, and you have to go on through each and every questions in super model paper as well as normal model paper as well as previous content that we have on the YouTube. So this is the order, and our next order is like you just have to do the question practice and do the revision. Revision, repeat. That leads to the good result, good rank. Got it? So first question for you, like which of the following, first question for you, and they're asking like which of the following method is reversible form of contraceptive. So in the given option, we have the contraceptive method like tubular ligations, in which we are just tie the fallopian tube. Vasectomy, that there is a tying in the vas differentia. Next you have the IUD, that is intrauterine devices you have. Then you have the hysterectomy. So hysterectomy, that is completely removal of your we can say uterus. Vasectomy, that is a vas differential, that is for the male. Tubal ligation, that is for the female. So which of the following are the reversible method? Like hysterectomy, that is completely irreversible. There is a 0% chance of the pregnancy again. Same is in this vasectomy and same is in the tubal ligation. But intrauterine devices that we have, like copper T, basically used as intrauterine device. So in that case, there is a chance that the failure of the contraceptives as well as the fertility get be reversed. Got it? So intrauterine devices, that is a reversible form. We have a small T-shaped device that is inserted into the uterus by the healthcare provider, or we can say gynecologist, medical practitioner, and it is highly effective at the prevent pregnancy, but can last in several years depending on the type. Next question you have, like what is the most common method of contraceptions worldwide? So worldwide, which of the following common method is used nowadays? So you have the option like condoms. Next you have the oral contraceptives, tubal ligations, and vasectomy. So student, as a method of contraceptions worldwide, the now generation is using the oral contraceptives. They are just taking the pills Saheli, they are just taking the multi-loaded 375, they are just taking the misoprostol, they are just taking the mifepristone also. So oral contraceptive, that is the most widely used method for the prevention of the pregnancy, as tubal ligations and the vasectomy. Among them, tubal ligation is more and vasectomy is less. And the condoms that are basically used but not too much in the country. Got it? So oral contraceptives, that is commonly known as the pill, it is the most widely used method of the contraceptive globally. And they are just taken the orally synthetic hormonal preparation to prevent the evolution, to prevent the implantation, we can say to prevent the development of the fetus also. And there are so many consequences of the oral contraceptive. It is ineffective, and as well as there is a chance of reversible of the contraceptions. Sometimes they cannot work, even there is a fluctuation in the hormonal level. So female have to suffer so many type of adverse effect of using the oral contraceptive. Next question for you, which of the following is a benefit of the breastfeeding for the children? So for the lactating female, what are the benefits she have to take by feeding the child? So first option, like increase in the risk of infection. No, this is absolutely wrong. Next, they can reduce the risk of obesity. Okay, we can consider it now. Then higher likelihood of the allergy. No, it is also absolutely wrong. Then slower brain development. No, this is also this is totally wrong. So you have the option that is breastfeeding by the risk of the obesity. Breastfeeding that provide the nutrition benefit to the children, as well as the mother is getting the reduced or we can say the chance of the obesity is going to be reduced. Next question for you, which waterborne disease is caused by the bacterium that is Vibrio cholera? So one question from this question, like they can ask like Vibrio cholera is infected by, Vibrio cholera is spreaded by. So this is the waterborne disease. That is we can say and the food can leads to the Vibrio cholera. So it is associated with the water. We can say contaminated water and the sources like bacteria, that is cholera. So cholera bacteria, or we can say the disease that is cholera, is transmitted by the waterborne disease, or we can say transmitted by the bacterium that is Vibrio cholera, or as I told you that ingestion of contaminated food and water, and inadequate sanitation and hygienic practice can also leads to the we can say chances to increase the chance of the cholera. After, what is the primary route of exposure to waterborne pollutant? So primary route of exposure to waterborne pollutant, you have the option inhalation, ingestion, absorption through the skin, through direct contaminated. This is a single option, that is ingestion, like taking the we can sorry, this is not the correct option. Primary route of exposure of waterborne pollutant, we have like exposure water pollutant is ingestion, and which occur when the contaminated water is consumed. Like contaminated is okay. If there is a contaminated water in just adjacent of me, but if we are to ingest that water, if we are going to eat the infected water, then it will cause the waterborne disease. Got it? So next, we have what is primary effect of industrial waste discharge in water bodies. In industrial discharge like harmful chemicals, chlorofluorocarbon, harmful gases, CO2, methane, carbon monoxide. So they are just going to increase the oxygen level, okay, increase the turbidity of the water, like contaminate with the toxic chemical and improve the aquatic improve the aquatic biodiversity. So this is only the single option that can tell us simply like the contamination with the toxic chemicals are the primary effect of the industrial wastewater drainage of the water bodies. So primary effect of industrial wastewater discharge into the water bodies is contamination with the toxic chemicals. So you have the heavy metals, organic compounds, solvents, and other hazardous substances to the, we can say, industrial pollution of the water, as well as these are the industrial waste. Next you have, which of the following is not a common method of sewage disposal? So we have many method of sewage disposal. So you just have to find out which is not a commonly used. So which one of the following is not a common? So you have the sewage treatment plant, land ocean dumping and incineration. So ocean dumping, that is the not a common method of sewage disposal. Suppose I am just leaving. I am just living in the Madhya Pradesh, I am living in the Uttar Pradesh, I am living in the Gujarat or Rajasthan, Haryana. So it is impossible for me to take such type of luggage and dumping it into the oceans. Even that is leads to the concern with the environment also, as well as we have to follow the ecosystem, we can say habitat also, as well as we just have to take the mindset that it is going to affect the other biodiversity also. So ocean dumping is not a common method of sewage disposal, particularly in the modern times due to environmental concern. Got it? So historically it was practiced that but can be largely phased out or heavy regulation due to the detrimental effect on the marine ecosystem. Like the chemicals that we are going to dispose into the oceans are coming back to the river, coming back to the pond, lake, well that we have, and directly contaminate the whole the chain system of the ecosystem. Got it? So next question for you, which of the following is the method of the solid waste disposal that involve the decomposition of organic waste by the microorganism in absence of oxygen? So method of solid waste disposal that involve the decomposition of organic waste by the microorganism and there is a absence of the oxygen. So option you have incineration, in which there is a use of the high burning or high temperature is required and oxygen supply is also there. Landfilling is there, compositing is also there, recycling is there. So recycling we are just not going to do the decomposition. Landfilling just we are just doing the filling of the lake, but compositing, that is the only method of solid waste in which the organic waste is decomposed by the microorganism and there is the absence of oxygen. Some anaerobic bacteria are going to decompose the organic material in absence of oxygen. So we are done with the social pharmacy chapter. Now moving to the next part, that is pharmaceutical chemistry. We have, so pharmaceutical chemistry we are going to cover in this chapter, in this part, about your whole the chemistry, either it's from inorganic chemistry, physical chemistry, organic chemistry, analysis part, as well as the medicinal chemistry that we are going to plan with this question. So if you are having any concept that like you are unaware or like you are having the phobia, sir, how can I remember the medicinal chemistry questions? For that, just you have to watch the model paper that we had uploaded in the YouTube channel, like particularly from the medicinal chemistry point of view, and just you can remember the explanation, remember the question that we are going to discuss here. There will be maximum chance the question from the medicinal chemistry in the examination are come from our content also. So first question from the chemistry part, according to the Bronsted-Lowry theory, a substance is that. So Bronsted-Lowry theory that tells us a base. So basically Bronsted-Lowry theory is related to only and only non-aqueous method. It is related to the non-aqueous method. Whereas our Arrhenius story is basically dealing with the aqueous solution, like water we are taking in that. So base are the substance. You have option acceptor proton, okay. Donate the proton, donate the electron, no. For the electron, we have the Lewis theory. And for the hydroxide ion, we have the Arrhenius theory. So there is only the two option, like accept the proton and donate the proton. So base, that is accept the proton, and you are able to see the explanation of all the theory. Arrhenius theory, that is basically for the aqueous medium, and H positive releasing ions in the medium are your acid, OH negative ions are your base. So Bronsted theory tell us that your acid are the proton donor, that is acid are the proton donor, ADP, sorry. So acid are the ADP, means acid are going to donate the proton, and base are just going to accept the proton, that is by Bronsted theory. That is BAP, means base is going to accept the proton, whereas acid is going to donate the proton according to the Bronsted-Lowry concept. Next we have the Lewis theory. Lewis theory basically concerned with the electron pair. So according to Lewis theory, acid are the substance that can accept the electron, and base are the substance that can donate the proton, donate the electron. Base are the substance that are going to donate the electron, BDE, that is base can donate the electron according to the Lewis theory. Acid are the substance that can accept the electron pair according to the Lewis theory. So next you have the chloro group, that is present in which position of chlorothiazide. Chloro group, that is present in which position of chlorothiazide. So we have the chlorothiazide drug, that is basically the thiazide diuretics we have. So at the sixth position of the benzene ring, or we can say at sixth position of the benzothiazide ring, there is a presence of the chlorine ring. As the name indicate, chlorine, chlorothiazide. So we have the thiazides that are the diuretics. So next you have just to find out what is the number of the significant figure in 433.00. So 433.00 are having how many significant figure? You just have to find out. So 433.00, that basically contain the 5 significant figure. Basically contain the 5 significant figure, and 433 that are the digit and that are also count as a significant figure, whereas the trailing zero, means the zero after the we can say point are known as the trailing zero, are also significant as they indicate the precision of the measurement. So precision of the measurement is going to be, we have to count into the significant figure. Got it? So next you have calamine. What is calamine? So as you know very well, calamine we had prepared in our B Pharma first year diploma level in the first semester. We just used to prepare the calamine lotions. So you know very well that it is a basic of the zinc oxide. So calamine, that is used to relieve the itching, pain and discomfort of the minor skin irritations that is caused by the poison oak, poison sumac, or poison ivy. And calamine lotion containing the active ingredient, that is zinc oxide, as well as 0.5% iron oxide. And iron oxide is going to provide the distinct pink color, as we I think you are going to remember that calamine lotion that is available in the market also, and that we are used to prepare in the B Pharm first semester, contain the pink color. So it is the OTC item. We can say we can take the calamine without no need of the doctor to purchase the calamine lotions. So it is used as a astringent, antiseptics and protectant for the skin. As I told you, it is having the pink powder, odorless and tasteless, insoluble, or we can say almost insoluble in the water, but dissolved in the mineral acid also. Question for you: which is used for the limit test of arsenic? Which of the following is used? So there is jet apparatus, Oswald method, that is related to the gases. Arrhenius method, that is I told you that Arrhenius equation is there. Arrhenius method, that is we can say activation energy, it is basically dealing. Carl Fisher method, that is related to the analysis part. So there is only the single option, that is Gurdjieff method, that is used for the limit test of arsenic. Basically other limit tests that are basically in the Netherlands, but this apparatus for the arsenic limit test, that is Gurdjieff apparatus. And the lead limit test according to the IP is in the separating funnel also. So test of started with the arsenic acid, that is present in the form of HCaSO4, and in presence of stainless potassium iodide, that is acting agent, and it convert the arsenic acid into the arsenious acid. So arsenious acid, and then arsenious acid is going to further react with the hydrogen. In presence of zinc and HCl, it can form the arsine gas. And then this arsine gas is react with the mercury chloride paper. This is the paper that we are going to use, that is having the composition mercury and chloride, and there is a formation of the yellow stain. Means like the arsine gas is produced from there, and it goes upward and it is trapped by the mercury chloride paper, that is HgCl2, and it perform the yellow stain there. There is a formation of yellow stain, and on the behalf of the intensity of the yellow stain that is formed on the mercury chloride paper, we can examine like how much impurities, how much quality and quantity of impurities of arsenic the given sample have. So next question for you, just you have to find out the structure of the platinum. Just you have to find out the structure of the platinum. You are having the option. Just look at the option. Platinum is there. There is a phosphorus. There is no platinum is there, and there is also the platinum is there. So platinum, cis platinum means somehow C's pronunciation is here. So there is a chlorine group may be there. So we have the only one option that contain 2 chlorine group, 2 amino group. So cis platinum is having the chemical name, that is it is diamino dichloridoplatinum. And the given structure that contain the 3 cyclic ring having the nitrogen at a heteroatom and phosphorus as central atom, that is thiotepa. Then this is our 6 mercaptopurine. Then this is your carboplatin. So carboplatin, cisplatin, thiotepa, mercaptopurine, these all are your anti-cancer drug. So cisplatin, carboplatin are having this side effect, that is nausea and vomiting. That is the more prominent effect, in which just we have to give the ondansetron. You have to be remember all the drugs classification from the ANS, CNS, CVS, endocrinology, hematinics, your chemotherapy, your anti-cancer. Classification part is very important from the pharmacology as well as the medicinal point of views. Got it? So next question for you, the pyridine is a 6-membered ring which contain carbon atom. Pyridine. Pyridine contain a compound having the 6-membered structure. So it contains carbon and one more atom. Nitrogen in the structure. So pyridine having the 6-membered ring structure, having the nitrogen as a heteroatom. Pyran having also the 6-membered bonding oxygen as a heteroatom. Same is for the 6-membered structure having the sulfur as a heteroatom. If it is saturated, nitrogen is there, that is known as pyridine. If it is unsaturated like this, pyridine. If it is saturated, or we can say oxane, we can say sulfur, it is thiane, and thiopyrene if there is unsaturated, and pyrene if it is unsaturated containing oxygen as a heteroatom. Next you have which among the following compound were used in the formulation of the war gas. So in the formulation of the war gas, which of the following compound were used? So which among the compound were used in the formulation of the war gas? You have mechloroethamine that is used in the formulation of the war gas. So it is nitrogen mustard alkylating agent having the anti-cancer property. So the drug that is a analog of mustard gas as are derived from the toxic gas welfare research, that is mechloroethamine. It is a nitrogen mustard alkylating compound having the anti-cancer property, and this compound used in the formulation of the war gas also. You are able to see the typical diagrammatic or we can say chemical structure of mechlorothermine having the two chlorine group, and amine group is tertiary amine is there containing one amino group and two ethyl group is also there. Got it? So this is the structure of your mechlorothermine. So dear student, we had done with the questions of your social pharmacy as well as we had done with the question of your pharmaceutical chemistry. So you have to pause the sessions completely. Like sir will take you, like sir will take the class of the cognosy as well as previously part you have to watch, and we are coming soon with the next part also. For that you just have to revise the remaining part that you have, or you are having a attitude that today is your last day of your preparation, tomorrow will be your examination. You know very well you are at the last days, you are on the last days of your examination. So this is the right time to do the hard work, to take a splint, to take away from yourself from the we can say crowd of the many aspirants. Got it? So thank you everyone for joining session, and please be continue with the next faculty questions. Thank you everyone.
For pharmacognosy. So let us start this questions. Okay, first question in this fourth part of super series. Biological source of phenyl is, so what is the source of phenyl? Option A, plant agavita, B, Phoeniculum vulgaris, C, Terminalia azunia, and D, Cacia angustifolia. What is the source of phenyl? What is source of phenyl? Yes, that is Phoeniculum vulgare is the right answer. Phoeniculum vulgare. So that is the source of phenyl. That source of phenyl. Yes, you can see this phenyl having the synonym of Fructus phoeniculum, but it is obtained by the plant species called Phoeniculum vulgare Miller family Umbelliferae, and it is one of the volatile oil containing drug. It contains phencone and anethole as a chief constants here, aspirants. Next one. The coriander belongs to which botanical family? Coriander, most of the volatile oil containing drugs or belongs to Umbelliferae. So that is that coriander contains any volatile oils? Coriandrol. Okay. Yes. So the option A Liliaceae, B Solanaceae, and C Umbelliferae, and D Lauraceae. What is the right answer? Yes, umbelliferae is the right answer, dear aspirants. Yes, coriander, there is known as Fructus coriandri or cilantro leaves and Chinese parsley, and it is obtained from the dried ripened fruits of Coriander sativum umbelliferae, dear aspirants. Okay. Yes, so that's the right answer for this question. And next one, the devil's tongue is another name of which drug? Either myrrh or Google, asafoetida, or Peru balsam. Okay, devil's tongue is another name of myrrh, Google, asafoetida, and Peru balsam. Okay, yes. Let us see. Undoubtedly, asafoetida. Asafoetida is having the synonym of devil's tongue. Okay, it is obtained from the Ferula foetida. It is an oleogum resin. Okay, Ferula foetida. Ferula foetida, and yes, it is an oleogum resin, and it has the synonym of devil's tongue. Okay, yes. Next. So what is the source of clove? What is the biological source of clove? Either, yes, you can check that the clove is a flower bud. So accordingly choose the right option. Dried flower bud of Eugenia caryophyllus family Myrtaceae, dried flower bud of Eugenia zambolona family Myrtaceae, dried ripe fruits of Elatria cadamum family Myrtaceae, dried flower bud of Eugenia indicum family Myrtaceae. The eugenol, the clove contains the active constituents called eugenol as well as caryophyllin. So accordingly, you should select the right answer. Yes, undoubtedly option A is correct. Eugenia caryophyllus, because it is known as caryophyllum, clove bud and clove flowers. It is obtained from the Eugenia caryophyllus, belong to the family Myrtaceae. It contains eugenol as a chief principle of this flower bud. Okay, yes. Kattha is a synonym of pale catechu, Kantkari, black catechu, and D storax. So what is synonym? Kattha. So Kattha is synonymous for the which drug? Yes, It is for the black catechu. It is for the black catechu. It has the synonym of katta, but it is obtained from the acacia catechu. This plant is obtained from the acacia catechu, and it is also a dried liquid extract or dried aqueous extract from the hardwood of acacia catechu. We know the family Leguminosae. Okay, katta is a synonym of katta, synonym of catechu. Katta catechu. Next question. So, what is the source of Rauwolfia? What is the biological source of Rauwolfia? Yes, we know very well. The Rauwolfia is a leaf or root or stem. It contains a rhizome as well as roots of. We can see the direct option. Yes, because Rauwolfia serpentine or Reserpine, Sarpagandha or Indian snake root is a synonym. So that it is a root. So undoubtedly you can select this option because it is obtained from the dried roots and rhizomes of Rauwolfia serpentine, belong to the family Apocynaceae. Very important. Serpentine root, Indian snake root, Chand and Sarpagandha are the synonym of this Rauwolfia. Next one. The cotton consists of either A. cellulose, B. protein tubulin, protein keratin, protein myosin. So what contains? Cotton contains? Let's see the right answer. Yes, cotton contains cellulose, dear aspirants. 90% is cellulose. It is contained 90% cellulose and wax, oil and fat and other moisture. But the absorbent content consists of almost pure cellulose. Consists of almost pure cellulose, dear aspirants. Okay? Yes. And yes, the volatile oils are primarily composed of which type of compounds? The volatile oils are primarily composed of which type of compounds? Either proteins, carbohydrates, terpenes and nucleic acids. Okay, so let us take the right answer. Yes, they are contains terpenes. Yes, they contains terpenes. So because these terpenes are the diverse and large class of organic compounds produced by the variety of plants, as well as they are the primary components of volatile oils, and because of this terpenes only they do get the aromatic as well as therapeutic properties of the essential oils. So yes, this is for the today's video, and yes, my dear aspirants, as I always do subscribe this channel, and it is very useful for you and your friends, and do subscribe and share to your friends. Thank you.